It's wonderful to see so many people joining us this afternoon. Welcome, welcome, everyone. Thank you so much for joining us for NOLA's 2026 legislative wrap-up. I'm super excited to be able to present some amazing presenters today. I think quite a few of you already know most of them, but for those of you who don't, I'm excited that I'll be able to introduce Vanessa Saavedra. She is NOLA's senior attorney. Lychee P. Leong, excuse me, NOLA's senior policy advocate, Carrie Glover with DESDIC Public Affairs, and our very own Emily Bryce, my co-executive director. So we're really excited to have everyone join us today. I'm sure all of you know a little bit about NOLA's history. We started in 1999 with our wonderful founding executive director, Janet Varon. We are still a nonprofit organization, and our focus is that we want to make sure that everyone in Washington state can access affordable quality health care. So we're going to get started on our webinar. Everyone make sure you get your coffee or your lunch, turn your volume up while you run around your kitchen or your office and get things settled. Just give a little bit of housekeeping rules before we get started. For those of you who are questioning, yes, this event is being recorded. We expect to get through some of the content of this presentation. Unfortunately, we've got so many things to share. We're going to do our best to share as much as we can with the 60 minutes that we've got together. And each selection, we're going to have a different presenter throughout the presentation, so it kind of keeps everyone excited and present ready for the presentation. And in case you were wondering, yes, the slides will be emailed out to all of our participants. If you have additional questions, if you have technical issues, please don't hesitate to shoot something in the chat. If you have technical issues, our communications manager, Melissa Warner, would be able to provide you assistance. You'll see that in there. And I also want to remind us that this is a really good we'd like to have a really good conversation with all of you. So if you have questions, please don't hesitate to shoot them in the chat, and there will be a time at the end for real Q&A. All right, so to start our session off, I would like to introduce Vanessa Saavedra. She is NOLA's senior attorney, who her focus is a little bit of everything. We call her our generalist. Vanessa?
Thanks, Daphne, and good afternoon, everybody. Thanks so much for joining us. This session, as you likely know, was a short session that just ended on March 12th. This was a supplemental budget year, and some of the most important elements of this year were created quite some challenges. There were major federal cuts, primarily thanks to HR 1, which is officially known, unfortunately, as the One Big Beautiful Bill Act. And that bill or that law made major cuts to healthcare, food assistance, and other programs that people really depend on. And then in the state, we were also looking at a $2 to $5 billion state deficit over a 4-year outlook, which was considerably better than was originally projected, at least, but still represents a substantial deficit. Next slide, please. Okay, for the federal landscape, we have this handy chart here. This shows how HR 1 primarily affects Washingtonians. It also includes on that first line the effects of Congress's failure to extend the enhanced premium tax credits. You'll see the numbers are really tremendous of people who have already lost coverage and who will still be losing coverage or are likely to lose coverage. And the two categories that you'll notice were really hardest hit or targeted are immigrants and lawfully present immigrants who have traditionally been able to get medical benefits, have lost or will be losing them, again, thanks to HR 1. And the other category is people in the Medicaid expansion, that's adult Medicaid, a particular eligibility pathway where the primary requirement is just that people be low income. It's not the eligibility categories tied to official designations of disability or what's known as classic Medicaid. So the work requirements will apply to this particular section of Medicaid recipients. And it's not likely to be due to lack of eligibility, but rather due to the administrative hurdles required by the work reporting that the feds are predicting savings, which is to say they're expecting people to lose coverage even though they're eligible. And that's how they project savings from that. So, our job is to try to minimize the loss of coverage to those people who are eligible, but challenged with the administrative requirements. So, now I'd like to hand off to Carrie Glover to tell us more about the state context.
Yeah, thank you so much, Vanessa. So as we said, this was, and as many of you are familiar, this was a short legislative session lasting just 60 days. We in Washington operate on a 2-year biennial cycle. So the first year of the biennium was last year, and that was the long session, 105 days. The legislature comes together to write the full 2-year biennial budget. In the second year of the biennium, they come back and typically what we do is make tweaks. It's a lot of times, they've set the stage with the 2-year budget. A lot of times the second year, the second session is a little bit more stable. We have the legislature has written a budget within that context of the 2-year biennium. And so you come back and you make tweaks. The way I say it is you come back and you balance your checkbook a little bit. And you might pass bills that address emergent and urgent issues that have arisen since you passed the full budget, since you were in the long session. You come back and do tweaks. This year, a little bit different in a lot of different ways. So this was a short session. It did last 60 days. Wasn't sure right up until the end whether we were going to get done on time, but we did. But going into session, we once again faced a significant budget shortfall. And this severe of a budget shortfall is not typical. A lot of times we see that big shortfall like we did last session. Saw a big shortfall last year, and they passed big revenue last year, and we worked and made some cuts and whatever to rebalance. And then it is not typical to have to come back and in a supplemental budget to all of a sudden be facing another multi-billion-dollar shortfall. What created this landscape? There's a lot of things that came up in that interim within that brief period of time, 8 months, that all of a sudden we were plunged into another shortfall, having just balanced the budget on the 4-year outlook. All of a sudden we're in another shortfall again. A lot happened in that time. Of course, we've all talked about HR1 and the impacts that has on some of the programs, the healthcare programs, the food programs that people in the state are dependent on. But it goes beyond that. There's things like tariffs are having an impact on our economy. We're a heavy trade state here in Washington, and the impact of the tariffs is impacting business in Washington, which impacts the revenue that comes into the state and the overall stability of our economy. Also, we know that not just in Washington, but everywhere, the cost of maintenance life has increased. I don't know about you. When I go to the grocery store, the cost to buy my groceries is a bit more this year than it was last year. That's due to a myriad of factors, but that's the reality that we face as individuals, but it's also the reality of the state. So the cost of maintenance level, just to keep doing what we're already doing, has gone up a lot. And so that's created a shortfall just for existing programs and services. We also had a lot of change. We came in Washington State last year. We have a new governor. New governor means new heads of state agencies. And we had a big turnover and a lot of new legislators. And so there's a lot of change. Our revenue has declined. And so all of that meant that this wasn't going to be going into a small making tweaks supplemental budget. Sorry, 1 second. Everyone, I have a new puppy and she just rocked her column. I'm so sorry. It's important to me being able to talk to grab that. So going into session, we had a lot of change, a lot of challenging things before us. And a lot of that was around the budget landscape. And so going into that, to address such a significant budget shortfall, you'll see in the slide here that we were facing a 2 point when you factor in maintenance level costs, federal changes, mandatory spending, non-mandatory spending, all of these, and updating the revenue forecast. All of this created a $2.3 billion shortfall just for the current 25-27 biennium. In Washington state, we also have this requirement called the 4-year balanced budget requirement. That means that we not only have to balance the current biennium, we also have to balance the next ensuing biennium. Spoilers, the next ensuing biennium is even projected to be worse. All of these changes, these federal changes, this impact on the economy has a compounding effect that is looking to decline even more in the 27-29 biennium. So all of this was stacking up to be a very challenging hurdle to overcome of how are we going to balance this budget in 60 days, especially if we look to the 4-year outlook. And so the first thing we look to as we're getting ready to launch into session is we look at the governor's budget and the tone that he sets in that. It was interesting because the tone that was set was not only what the budget that he released showed, but also timing of it. And I think that timing is significant because most of us think that the budget proposal has to be released by the governor by the 20th. And so like that's generally what we operate under. We all had to learn this year that that's actually not true. That is true going into a long session. And that is often what happens. We just kind of have this landmark, but in a short session can actually release up to 20 days before the legislative session begins. And this was because so much was changing that he wasn't prepared. He was having to make last minute tweaks, and with OFM and state agencies, he was having to make these changes to make sure that he's releasing a proposal that reflects the landscape accurately. And so we didn't see a proposed budget from the governor until December 23rd. In my time in Olympia, I have not seen a budget come out that late from a governor, and that is fully legal and within what's allowed and what's possible. But it was something that was very different this year than is typical and shows just like what we were facing in this landscape. Another thing that was interesting, so I talked a little bit about how we have a 4-year balanced budget requirement. We do have an escape hatch on that 4-year balanced budget requirement. And a couple of factors have to be met by that. One is slow employment growth of less than 1%. The other is drawing from the budget stabilization account, or also known as the rainy day fund. When we saw the November revenue forecast come out, that employment growth, unfortunately, for the state of our state's economy, unfortunately, it was below 1%. It was 0% in November. And then so the governor had at his disposal the ability to do the escape hatch and only balance on the 2-year, not the full 4-year outlook as required. Typically, that requirement to balance on the 4-year could be waived. And so he did take up that escape hatch option. So what we saw was put out, it was still a lot of cuts because even with, as you can see from that, even within our current biennium, there is a shortfall, but he didn't have to make as severe cuts because he balanced on the 2-year, not the 4-year. Okay, next slide. So that tone was set by the governor and very much carried through. And it was a question of whether the legislature was going to proceed with that balancing on the 2-year instead of the 4-year as well. We needed that in order to have that as an option. The employment growth needed to remain low in the February revenue forecast, and it did. We stayed below 1%. The legislature had that option at them, that escape hatch, so that they did not have to balance on the 4-year. And what we saw was they ultimately took up that escape hatch. And I think it's really important to note that this doesn't make the problems of the next biennium go away. We very much have that lies ahead, but what it means that we can have that bigger conversation in a longer session when we have more time to contemplate bigger changes, when we have time to see things roll out a bit more, some of those federal guidelines, some of those federal changes settle in a little bit. So much is in flux that it's really hard to make those decisions in such a short amount of time. So we're still going to have to come back and deal with that in the future. But for now, the legislature did draw from the rainy day fund. We saw that low employment growth, and therefore they also balanced on the 2-year instead of the 4-year outlook. I'm doing this out of order because I was already talking about budget, so I'm just going to keep going on budget. So we did see a limited amount of new investments. There are things that I always say, like what's emergent and urgent is what we usually address in the supplemental budget. That filter of what's emergent and urgent was even higher this year, given the budget landscape. So there was very little new policy. There was some 620 million, but for the most part, we maintained status quo or things were reduced. There were targeted cuts to health, human services, early learning, as in particular, took some hits, education. There were some hits in those spaces, though I will say it was less than we feared because they bounced on the 2-year instead of the 4-year, and because we also had some new revenue. This budget landscape also very much set the stage for the bills that were considered and that ultimately passed. Bills that came through were very much directed like, bills usually cost money to implement. Even if it's just an FTE at a state agency to implement something, bills almost always cost money. And legislators were told, we don't have the money. So not only can you not have budget requests or can we not consider a lot of new funding, we also cannot consider bills that are going to have a hefty fiscal note that are going to have a cost to implement. So that whittled down the number of bills that were introduced. It whittled down the number of bills as we went through the process. The bills themselves were shrunk down to what they could do to fit within this fiscal landscape. And what we saw was that 267 bills passed the legislature. This is far fewer than is typical, even for a short session. For comparison, in 2024, 334 bills passed in a supplemental year. So this is out of thousands of bills that were introduced this year or carried forward from last year. Only 267 made it through the process. And those bills that did make it through were much smaller and whittled down than they were as originally introduced. Go ahead and go to the next slide. Of course, with this budget landscape, one of the big pieces of conversation was revenue. And I think everyone hopefully picked up a paper at some point in time over the past couple months and learned a little bit about the millionaire's tax that was contemplated and ultimately passed by the legislature. This is progressive revenue that includes a tax on earnings over $1 million a year at 9.9%. Revenue is estimated to grow over $5 billion in subsequent biennia. And some of that money was very specifically dedicated to things like working families tax credit, going into the account for the Fair Start for Kids Act for early learning, and putting an intent to, in the future, fully fund free school meals by 2029. This is a progressive revenue option that a lot of us are very excited about that it got through. It's really a big move in this, but it doesn't start to draw down revenue until 2029. So it does not fix the problem of this session, this biennium, nor the next. So we still have some work to do in that space, but it very much lays the groundwork for more sustainable revenue going on in 2029 and beyond. You'll see we listed a couple other revenue bills that were passed. A lot of these are repealing tax exemptions that exist around warehousing of prescription drugs, stuff around data centers, and clarifying the tax on insurers, the B&O tax on insurers. Those are all a little bit wonky ones, but all of that was important revenue that comes in quickly and helps us address our immediate budget shortfall. I will hand it over to, I think, Emily next to talk about some of the healthcare specific priorities.
Okay, thank you, Carrie. Appreciate that. That was really helpful. And now we'll spend some time talking about healthcare priorities, and then we'll see how many other bills and budget items we can get through because we have quite a bit here. Let's dive into some of our key session takeaways, and we'll focus first on NOLA's top priority areas. If you came to our session preview webinar 2 months ago, which feels like forever ago in legislative years, you'll remember that NOLA prioritized 3 areas this session. First, defending the health safety net. Second, improving healthcare affordability. And third, expanding healthcare access. And those priorities come from conversations with Washingtonians, with many of you in the room, with many outside of the room, and all over Washington state about what they're facing. Because even headed into this federally induced crisis that Vanessa spoke about, we know from a survey of 1,300 Washingtonians that we did with partners in fall 2025 that 2 in 3 Washingtonians reported not getting care they needed due to cost, and 1 in 3 reported struggling with medical debt. So that's our horrible baseline that we know that we had even before the federal cuts that Vanessa mentioned, are now threatening coverage for 1 in every 20 Washingtonians. So we knew headed into this session that it was going to be really important to hold the line against further state cuts and try to make as much progress as possible in a short 60-day session. And for those who haven't seen that survey, I'm going to put that in the chat. And that's worth taking a look at when you get a chance. Okay, so how did we do this session? The good news is that our collective advocacy, with many partners in the room and outside of our Zoom room here, together we made a lot of really important progress. We had important wins for patients and healthcare consumers this session. And we did that together. NOLA counted up organizations that we did sign-on letters with, for example, and we had nearly 350 partners in this work. So all of us together made good progress. And this slide just shows a snapshot of some of those wins, including adding more immigrant coverage slots, and Leachy will talk about that, winning more premium assistance for lower wage Washingtonians, we'll cover that, expanding state tools that can help us begin to tackle healthcare costs, and successfully defeating some truly horrible budget cuts and bills that would have rolled back care. We're going to get into each of those by turn. And in any other year, we would stop there. We would celebrate this progress. But of course, as we talked about, we're not in an ordinary year. We were looking for a state policy response this year that met the moment of the healthcare crisis that we're in. And in many ways, policymakers failed to deliver that response. And we'll talk about that as well. So we're going to talk about this session's outcomes, where they came up short for people, and where we need to build an even stronger call to action headed into the big session next year. Next slide, please. So going a layer deeper, we started this session with a twofold goal around the health safety net. First, protect healthcare programs and infrastructure from state budget cuts, given the troubled state budget outlook that Carrie mentioned. And then two, do everything we can to expand the state safety net to those losing federal coverage and those who've been excluded from federal coverage already, up to and including raising new revenue. Next slide, please. So the good news is that we managed to protect that state baseline against some terrible proposed cuts. We saw in the early budget proposals that came from both chambers of the legislature and the governor that policymakers were considering some serious budget cuts that we were able to fend off collectively. Notably, there was a proposal to cut physical therapy, occupational therapy, and speech therapy from roughly 1 million Apple Health or Medicaid adults in our state. And you might think to yourself, oh, physical therapy, is that the most important thing? Well, these therapies are really important if you suffer from a stroke, or you're recovering from a car accident, or you are learning to manage a developmental disability. And we heard from folks who were very, very concerned about this cut, and thankfully it did not happen in the final budget. We also saw a proposal to cost shift healthcare services for kids that was concerning. You may know that today many health services provided in schools are paid for using Medicaid dollars, which is a combination of state and federal dollars, and that's smart because it leverages that federal match. The proposal early in session that we saw would have shifted more of the state cost back onto local municipalities and school districts who, as we all know, don't really have a lot of cash these days. So that cut was avoided in the final budget. And then we also saw proposals in both chambers to sweep or take away, cut a so-called $33 million underspend from DSHS waiver programs for people with developmental disabilities, really critical care and services there. And advocates like folks from the ARC flagged that that would have cut into core waiver slots because the underspend was actually only between $0 and $8 million. So basically, they were taking money thinking that it was sitting there that wasn't really there. That error got flagged, and thankfully, we were collectively able to protect that as well. And we saw a lot of other things like that. The governor's budget, as originally proposed, had a piece in it that would have pared back long-term services and support care hours. That was avoided. And we really collectively were able to fend off those horrible cuts. I will now hand it over to Leachy to talk a little bit about how the health safety net for immigrants fared.
Thanks so much, Emily. I think that we all know that Washington has made progress in recent years, but as a reminder, back in 2019, 1 in 4 Washingtonians without health coverage lacked access due to their federal immigration status. And the significant progress Washington has been in the form of both obtaining permission from the last administration to let everyone in Washington use their own money to purchase health coverage on Health Plan Finder. Doesn't sound like a big deal. We are the only state that got that permission. But we also launched a Medicaid-like program. And so this slide focuses largely on that low-income Medicaid-like program. So on the furthest left light green bar, you can see that the legislature funded 12,000 spaces. However, in January, enrollment actually dropped below 8,700, that lime colored bar. Unfortunately, Governor Ferguson didn't allow the healthcare authority to let any of the almost 26,000 Washingtonians waiting for access into that program. That's that tall gray bar. And when Congress passed H.R. 1, that meant all immigrants living in poverty lost access to federal ACA subsidies. So that was over 10,000 people in Washington, that orange bar. Those people became eligible for Apple Health expansion, but remember, Governor Ferguson wouldn't allow anyone in. So this October, looking ahead, we see another 20,000 approximately asylees, refugees, and other lawfully present immigrants who are currently today on Apple Health, who are expected to lose their eligibility for federal funding, that lighter orange bar. Of those folks, approximately 2,700 currently utilize long-term care, care that keeps them in their homes, care that keeps them alive. So in January, I will note Congress will also take away Medicare from many lawfully present immigrants who've paid into that program for over a decade. But we don't actually have an estimate of how many people that is. So they don't get a bar on this chart. Next slide, please. There is some good news. Despite Washington's shortfall, the legislature did make decisions to mitigate H.R. 1 harms for some immigrants. While they did cut $28 million from Apple Health expansion, they are moving the program to fee for service. That means that 5,000 people will be allowed to enroll in January. They also funded long-term care for 1,191 people. Both of these programs are programs that are for Washingtonians not eligible for federal Medicaid. However, as Emily and others have noted, the fight continues because the legislature actually directed the Healthcare Authority and DSHS to report on how reducing benefits and services could expand program capacity. So we are very grateful to the legislature for not making more devastating cuts, but we've got a fight ahead. And we've also got lots of people who won't be able to win the lottery and get one of those 5,000 slots. So I'm going to put in chat a link to both the timeline of immigrant exclusions that are coming or have started coming, as well as a flyer that includes some affordable healthcare options. And now I will turn things back to Emily to tell you more about the marketplace stabilization efforts.
Thanks, Leachy. Well, the programs that Leachy mentioned aren't the only safety net that's available for immigrants and others in Washington. We also have Cascade Care Savings, which offers a fixed amount of premium assistance to people who are under 250% of the poverty level, who don't qualify for Medicaid and are buying their coverage through the state exchange. So folks who have lower to modest income but are buying their own coverage on Health Plan Finder. And that program is available regardless of immigration status to citizens and immigrants alike. We were worried heading into this session because the legislature did not have funding allocated for the upcoming fiscal year FY23 2027. We had some funds left over from a previous allocation, about 35 million, but that was far short of the previous funding level that we had seen, which was about 55 million. So we were coming up short headed into this session. The good news is the legislature did add back the missing 25 million back, so the program is level funded now in the biennium. Yay. The bad news is that we know that that level of funding is not going to be enough, given the fact that there are rising premiums. We had just a 21% premium increase this year, increasing demand, and of course, the loss of the federal enhanced premium tax credits. Which were a program that nobody knew about a couple months ago, and now we've all heard about it in the news. And a couple years ago, we did have the experience of Cascade Care Savings running out of funds. And so we're expecting 2027 is going to be another one of those tighter years. And the other bad news in this market for people who are buying their own coverage is that the legislature failed to pass a bill that would have helped stabilize some volatility in the market amidst this federal uncertainty. And that was Senate Bill 6210. Which would have given the exchange more authority to set higher standards for the insurers and the plans that participate in that exchange or health plan finder market. We worked really hard on that one. It made it all the way through to the last day of session, but did not pass the last day of session. So there's some interesting lessons learned on that one. And for a bit more bad news, we'll go on to the next slide. Then we're going to get into some good news, I promise. Okay, so one of the reasons why we didn't make more progress on backfilling the health safety net against federal cuts this year is that the legislature failed to pass a number of targeted revenue proposals. This slide is a horrible eye chart. I know it's much too much to absorb, but it shows something really important about this session that's a lesson for us to consider. Advocates and key legislative champions tried to move targeted revenue forward to fund more of our safety net against those federal losses and recognizing that the millionaire's tax revenue will not start until 2029. So we saw legislators try bill after bill to see what would stick. And ultimately, only one of those passed that's on this slide, Senate Bill 6182, which establishes a limited health plan assessment to fund abortion services with the intention of capturing funds that carriers have already set aside for those funds but haven't fully used. So that's good news, but it was really notable that many others that could have passed did not make it this year. For example, there was a payroll tax on larger corporations, the Washington proposal. We worked on two proposals to recoup costs from large employers that have a higher share of workers enrolled in Medicaid, and several proposals to tax insurers, including excess surplus or basically money that they have in the bank and are not using to cover premiums or costs. We are not sure if we'll see these specific proposals come back next year, but the issue of health safety net revenue is definitely unfinished business that's going to need work in the next year. If we go to the next slide, I will briefly talk about healthcare affordability, and we'll try to accelerate a little bit. I know we're a bit behind time. We have a ton to cover. So we just talked about efforts to protect the status quo from federal attacks, but of course it's not enough to maintain the status quo because we talked earlier about the challenging affordability problems that folks in Washington are having and the healthcare costs that continue to rise. So we worked with many partners this year to continue working on the underlying cost drivers that are making our healthcare more and more expensive, together with the Fair Health Prices Washington campaign. And we had three focus areas this session. Medical debt, let's just put a Band-Aid on the problem if we can. And then let's look at the underlying issues by slowing corporate influence in healthcare. That's driving up costs and tackling the underlying high prices themselves. If we go to the next slide, here again, we see a lot of unfinished business. From my perspective, the legislature only passed one bill this session that really had anything to do with healthcare affordability, and that's House Bill 2548, which was signed by the governor this morning. That bill gives the Attorney General's office greater authority to review proposed mergers and acquisitions of healthcare businesses. Why does it matter? Because we know consolidation in healthcare increases healthcare costs. That's well documented. And under this bill, the Attorney General will know when providers or hospitals are being bought up by corporate actors like insurers or private equity firms, and we'll know too because they're public transparency mechanisms. But aside from that one bill and another discrete bill related to ambulance bills, none of the other healthcare affordability bills passed this session. That was a lot of time saying bills in one sentence. That's really notable because there were some bills that should have been slam dunks this session, such as a bill that would have lowered medical debt interest rate from where it sits right now, a very high 9% year over year. And we know from recent polling that healthcare affordability is Americans' number one economic concern. Number one economic concern. So I think we're going to see a lot more conversation about why the legislature was not able to advance healthcare affordability bills this session. And I think that will relate to the election cycle as well. Okay, now I'm going to hand it back to Vanessa for a brighter spot around healthcare access.
Thanks, Emily. So our third priority was expanding access to care. And you can skip to the next slide, please. And so these bills that were passed this year were really about maintaining access in the wake of federal changes. So we've got a public health bill that discussed vaccines and preventive services. Language access was another targeted area by the feds that this bill, HB 2475, was geared to address, and improving access to abortion medications. Next slide, please. And while doing that, the legislature also showed a continued interest in reducing care denials at point of service. So we have this SB 5395 was an important prior authorization bill. It both increases transparency in the prior authorization process and ensures that artificial intelligence cannot be used to make decisions that are adverse to people's well-being. HB 2250 was a charity care residency bill that that NOLA worked very much to defeat, and it would have limited eligibility for charity care to people who can only prove Washington state residency. So we know that inquiries into residency really has a chilling effect on immigrants. So that would have been a detrimental bill for them, even though it had it was careful to note that immigration status was not a factor in charity care eligibility. It also would have negatively affected people with housing instability and people coming from out of state to seek reproductive care that they can't get in their own state. That bill died. On to the next slide, please. Okay, so this list is, again, the next few slides are going to be really an eyeful. Our intent is not to cover them all here. There's just too many. So we're going to focus on a few, but these slides will be posted publicly after this event. When you see bills that are marked at the end signed, it means the governor has signed them. They are laws now. When you see passed, they're in purple. That means that the legislature has passed them and they're awaiting signature by the governor. And then dyed there in brown means that the bill died. Next slide, please. Oh, nope, sorry about that. Back to Medicaid delivery system. Thank you. So legislators prioritized shoring up providers, but otherwise really kicked the can regarding coverage losses due to HR 1. SB 5981 was a higher profile bill that was touted as supporting the safety net, and in some ways it does help shore up provider funding for the safety net, but the benefits don't directly and clearly flow back to patients, so transparency requirements were added. Next slide, please. And for this one, I'll hand it back to Emily.
Okay, thank you, Vanessa. And just a reminder to folks, we are going very quickly. We're covering a lot of ground here and trying to focus on high-level pieces, as Vanessa mentioned, but please feel free to add questions or comments in the chat if you like. We are going to try to save some time, but if people have burning things that they want to ask about as we go through, please feel free. So it's always interesting to look at the technology and infrastructure that the legislature funds, because in addition to discrete items, they're always working on big projects that take a lot of the budget but are kind of operating behind the scenes. And some big takeaways that we noticed as we were looking about those big healthcare IT infrastructure projects is, first, the legislature continued many big existing healthcare IT projects. So you wonder, in a tight budget time, are they just going to pause the work that they've already begun? And in many cases, they continued some big projects like moving the classic Medicaid adults into an integrated eligibility system. Within the Health Plan Finder experience, there's funding that suggests that that will continue, that project will continue. There's funding that suggests that the work on Master Person Index, which is a project to try to follow people across different programs and make sure that we're better able to wrap them in services that they need, and a statewide electronic health record with a similar goal. Those projects continue to be funded in the budgets. We also saw that there was an effort to start new IT projects needed to comply with HR 1 in the federal landscape, and you hate to see money being from my perspective, wasted on this, but it does need to happen if the state is to comply with federal law. And so we saw funding for a new state-built technology hub that will support work requirements for Medicaid that is required by the federal law, and efforts to even get ahead of some upcoming federal activities. Like, we know that there's been an interest at a federal level in so-called Medicaid fraud, quote unquote, that is there really isn't evidence of in Washington state. But we see the state taking proactive moves in the budget to work on issues like concurrent Medicaid enrollment, where a person is enrolled here as well as in another state, maybe because they recently moved. So some kind of cleanup work that can prepare the state to better respond to any federal inquiries that are likely to be coming our way. Back to you, Vanessa.
Thanks. As far as the aging and disability bills go, a number of them were passed and signed, but what you'll see mostly here is that these are fairly narrowly targeted bills for specific problems. There aren't great sweeping bills that have a major impact on aging and disability care for the most part. Onto the budget, though, for aging and disability care on the next slide. There are a number of cuts, including area agency on aging case management reductions, direct and indirect care low-wage equity add-ons were reduced, and assisted living facility funding is slightly reduced. However, there was a 10% rate increase for adult day services, and the final budget does include $250,000 for a 10-year strategic plan to expand community-based services and reduce reliance on congregate institutional settings. That one's great to see because we're really seeing home and community-based services being targeted, and those are such crucial services for keeping people in their homes and in the community that we really want to support that rather than supporting policies that lean towards institutionalization instead. We also see the maintenance of health homes, which had previously faced a funding cliff. Next slide, please. And back to Emily.
Thanks, Vanessa. We try to give you a little variety in the speakers since there's so much here. Okay, on to universal health care. It was really exciting this session. We saw a lot of dialogue about universal health care and single payer movement this session in almost a way that we hadn't seen in some time in Washington. I want to give a lot of kudos to allies in the single payer movement and coalitions who kind of saw the opportunity with HR 1 to say, is there a better way for us to be delivering our healthcare system? And started a lot of conversations this session. So you see a number of bills here that took different approaches to trying to push the envelope on universal health care. And there's also one that we included in a previous slide in terms of Medicaid delivery system that would propose to move Medicaid managed care to a different kind of delivery system that's more direct contracting with providers. So these all took different approaches. The one that I just mentioned is sort of what if we took the state purchase care that we already have and we delivered it differently? And then you can see other bills here say what if we amended the Constitution to say that healthcare is a right? What if we established a trigger so that when the federal government is ready to allow states to do universal care, we're ready. So we saw a lot of different approaches here, and it was exciting to see the dialogue. Only one passed, ultimately, a joint memorial to the federal government aimed at drawing attention to how Medicare Advantage plans are undermining original Medicare in a lot of ways that have been well documented. So it's great to see that message go back to the federal government, and great to see some hearings and discussion this session on other items. If we go to the next slide, I won't spend too much time here. We already talked about how there was important work on protecting abortion services here in the state with a revenue bill that did pass. That was exciting, and that was reflected as well in the budget. There had been a cut last year to abortion services, sort of unprecedented level, and that was restored in this year's budget. And then we won't cover the rest of the slide for time, but we saw other reproductive health and gender affirming care bills and budget items, and including funding that I think is important, intended to help shore up gender affirming care in the budget given federal tax. And we saw some kind of placeholder language that's that last budget that says, we know we're going to have to do something on gender affirming care. We just don't know what it is yet. So here's some funding that's kind of held in the budget for that. Next slide, I will hand it back to Vanessa.
For patient rights and privacy protections, there were some efforts there, not as many passed as we would have liked to have seen, but the driver privacy protections bill regulating the use of automated license plate readers, including around certain protected healthcare facilities, did pass. One we didn't see pass, which we would have really liked to this year, is SB 5906, which would have required that healthcare facilities adopt policies barring immigration enforcement personnel from certain areas without a valid judicial warrant or court order. That one did die, but you are seeing here some efforts to ensure that immigrants' rights and privacy are protected. Next slide, please. In the public health realm, we did see a few public health bills pass. I won't go into detail on these. You can see them there, and all of the bill numbers are linked. So when you have access to the electronic version of these slides, you'll be able to immediately go to the bills if you want to read further about them. And for public health, we saw some important budget items and funding. But we also saw funding reductions for behavioral health staff and removal of funding for a number of programs and services across equity projects. Next slide, please. And back to Emily.
Thanks. So I think one of the takeaways that I saw around behavioral health is that for the last couple of sessions, we've seen the legislature really throwing everything they have at behavioral health. Lots of different investments, lots of different kinds of investments, recognizing behavioral health crisis for both children and adults. And this year, we actually saw some cuts in the budget around behavioral health, as Vanessa mentioned, some targeted program eliminations. And not that the legislature wasn't still very interested in behavioral health, but we saw just a little bit less, I think, this session passing than we have in the past few sessions. One bill that did pass is HB 2429. That bill supports the recommendations of the Children and Youth Behavioral Work Group, which have been working on a sort of roadmap over time to improve child and youth behavioral health. And there are a number of different changes in that bill, but one interesting piece is that it also requires the governor to appoint to the work group 2 representatives of federally recognized tribes nominated by the governor's Indian Health Advisory Council, and then requires that leadership council that gets set up there to report into the governor and provide updates and for agencies to align. So that bill you can see is kind of setting up the next generation of behavioral health work that will come for children and youth, and making sure that really important voices like tribal consultation is occurring in that process. And I think for time, because I want to make sure we have some time for questions, we'll skip the next slide on behavioral health budget items. We talked a little bit about that. And back to Vanessa.
Very quickly on healthcare providers, as noted at the top, we did see a focus on bolstering healthcare providers. And so there are 4 bills noted on this slide that did pass. Back to Emily for health insurers.
I'm looking at the time, and I think we'll skip health insurers, and go over to you for any final words on artificial intelligence, and then we'll give it back to Carrie for a couple more words about next session, and then leave a couple minutes for questions.
One thing we were really hoping to see was more regulation of artificial intelligence in healthcare. We didn't really see it to the robust extent that we would like in terms of establishing guardrails in both development and application. So hopefully next session we will see that taken on again. Next slide, please.
All right. Back to me. I think we can go to the next. Yeah. So that kind of gives you a brief overview of everything that did and the most part didn't happen this session. And so that's what we're very much looking at, what's ahead. You heard over and over again, like there's a lot of passing the buck, some of that is like, again, because what I was saying is how most bills cost money. There is no money. So you saw a whole lot of orange dyed throughout those slides. There was a lot of stuff that didn't happen this year. And even things that did happen, even those things that had the lovely purple next to it of bills that passed, those were very much whittled down. A lot that didn't happen this year, and there is a lot of work that lies ahead. So I think we're going to see a lot of those bills come back up. I think we're going to see a lot of new iterations of bills, how we're going to work to continue to refine these, how we're going to look as that federal landscape settles out, as we see the impacts of what HR 1 and other federal action means, as guidance comes out. We as a state need to figure out how we're going to respond to all of this and what that path lies ahead. And with the budget, again, as I said, we balanced on the 2-year. It was, in my opinion, the right thing to do so that we could work within the resources that we have. Balancing on the 4-year is very difficult, but it doesn't mean that 4-year outlook has gone away. Those instabilities and that budget shortfall in the 27-29 biennium very much lies ahead and will be a big lift going forward. They passed big revenue the past couple of years. We still need to look at what we what we can do to address that gap before funding from the millionaire's tax starts to come in. So there is a lot of work that lies ahead. Make sure you hydrate, make sure you read up, make sure you rest, and get ready for next session, because it's going to be another really big one with a lot of really significant work. We don't know if there will be an opportunity for an escape hatch again. They might have to balance not just 27-29 and 29-31. We don't know what that looks like, but I can guess that we're not going to move into a lucrative time by next session where there's a lot of additional resources. So we had a lot of hard work that lies ahead. We will have a lot of change. As always, when we go into these election cycles, after a short session, we always have a big election. The entire House, state House, and half of the state Senate are up for re-election. So we could see some people who are elected out. We have a lot of retirements happening, a lot of members who are running for different office, 10 House members by my count, and 6 senators either not running again or running for a different office. So we'll see a lot of change in the legislature itself. And then also a lot of work that lies ahead on revisiting these issues that didn't pass and whatever else emerges as new issues that we need to tackle by the time the next session rolls around. So rest up and get ready for the second Monday of January 2027. And I think with that, we're ready to open up for Q&A. I think I'm handing this back to Daphne.
Before we jump into Q&A, I would really like to take a moment, if you all would, and send a great thanks to our amazing presenters, Vanessa Saavedra, Lichi P. Leong, Carrie Glover, and Emily Bryce. Thank you all so much for all of the time that it took to prepare this information. We're really excited about the fact that you guys have a lot of energy related to this stuff, and we're looking forward to following you and hearing what we need to do to prepare for 2027. Thank you. One last little tidbit again, we will make sure that there's an opportunity for you to get the slides. But in the event that you found this information really, really useful, we would really love it if you would consider being a monthly donor. A small donation of maybe $5 or $10 a month really can go a long way to help us to continue to provide free resources for our community. And to that, I will give it to Emily. Let's see if there's any questions in the chat first.
I see one from Lydia. Thank you so much for a great question, calling out what can we do to advocate for increased access and affordability in the coming months, especially not knowing who are the new legislators. This is huge. We've been talking about this a lot, and I suspect we're all going to be talking about it a lot in our coalitions in the next couple of months. But I think the key thing is not letting people who are struggling or losing coverage as we speak become invisible to legislators and policymakers. We have already seen that we have numbers that 19,000 Washingtonians have lost coverage already, and we know that there are more that just haven't shown up in the numbers yet. And so it's going to be incumbent on all of us to be really loud and to not let those folks who are in our families, who are our neighbors, who I think all of us can think of somebody in that we know that we're worried about or maybe has already lost coverage, to find ways to share those stories, whether it's through media, social media, writing an email to your legislator and say, hey, I know it's June, but just so you know, my sister, here's the thing that happened to her. And I think we have to not let them off the hook because they're going to need that. And even our champions need those stories because as they gear up for the next session, they're going to need to be even bolder, and they're going to need to bring their colleagues along and be armed with that information. So I think that's my major thought is that we're going to have to make sure that we're doing really effective storytelling that shares what people are really facing in the state. Kathy, we've got what can we do during elections with candidates and incumbents? Ooh, okay. So NOLA is a 501c3. I am seeing David add a No Kings event that can certainly, folks can certainly consider given the federal landscape. And and many of you are part of our coalitions where we work on all these things together. So thank you. NOLA's a 501c3, but that does not mean we can't ask questions. And so when we see, for those of you who have the ability, of course, you can ask candidates what they're planning to do around healthcare access and affordability, and ask whether they will be taking specific action, because we saw that legislators, with some few very wonderful exceptions, failed to do that this session. So I think asking the question is something that's available to all of us. Send good question. Ooh, good. I love that, Lydia. League of Women Voters candidate forums. And there are a lot of town halls that are coming up too.
And I would add in that like the campaigns and the elections are an important and critical part of this. And then it's about holding them accountable once we get to session, because there's a lot of campaign promises. Promising stuff around healthcare is a really great campaign talking point because it hits everybody and people are struggling and suffering. But we need to make sure that when we get to session, that they are held accountable to those campaign promises that they make.
And I'd like to be a little mindful of our timing. We are actually at 1:30. For all of you who are able to join, we are so grateful. Thank you so much. Again, if you found this information useful and would like to continue seeing it, consider doing a monthly donation. If you did have additional questions that you would really like to get answered, please don't hesitate to email Vanessa or reach out to Emily or myself. I am Daphne Smith. I am the other co-executive director at NOLA. Thank you all so much for joining us, and have an amazing Wednesday.
And keep hope alive.
Love it, David. Thank you. Good to see
Absolutely.
everyone.
Yes.